Welcome, everybody. My name is Dr. Lianov. I'm the president and founder of the Global Positive Health Institute, and this is our podcast where we talk about all things related to positive psychology, health, and well-being. And so I'm delighted today to have with us Dr. Suzy Green. She's a clinical and coaching psychologist and the CEO and founder of the Positivity Institute, and is joining us today all the way from Sydney, Australia. Welcome, Suzy.
Thanks so much, Liana. It's really wonderful to be here and particularly talking on this topic.
Well, wonderful. And I dive in right away and say, okay, what grabbed your attention to this wonderful topic of positive psychology?
Yeah, well, positive psychology, I guess I say I grew up with positive psychology and coaching psychology, which hopefully we'll talk a bit about today. But I'm the love child, Liana, of these two fields because they were both emerging just as I was doing my doctoral research. And so my doctoral research was looking at the use of evidence-based coaching for the prevention of mental ill health and the promotion of psychological well-being. And in fact, my doctoral research did find that. So positive psych, I guess, for me as a clinical psychologist in my original training, as you know, was very much about treatment of mental ill health. And I had, as I started to come across some of the coaching research and then positive psych very early on, like it was 2001, which is still very early days in positive psych world, it was really resonating with me. And I'm thinking, why do we wait until people are unwell before we give them these life skills, was how I was seeing it, that I was learning as a psychologist and that I had small, relatively young children at the time. And I'm thinking my kids should be learning some of this stuff at school. So that's sort of where it all began. And I think, one of the reasons why I specifically was interested in health and well-being, I mean, the mental health makes a lot of sense, but in my doctoral research and then in other studies, coaching studies that I completed after that, we analysed the types of goals that people were setting. So my doctoral research was a life coaching study. So people could set any type of goal that they wanted to. And I can't give you the stats, but I would say it was up there like 80 to 90%. We asked them to set typically 2 goals to work on. And 80 to 90% of people would set a health-related goal. So it was very, very common. And then even when I started doing my research in schools, and a lot of students, and I would say in the studies that I did, it was a lot of female students who I think even to today, there's still focus on perhaps overplayed sometimes, isn't there, on body image, but definitely around health and fitness. So I started to think, wow, this is a really common area that coaching can be used for. Then I just wanted to learn more and more about it, and that's the beginning of the journey. I'm sure I can talk more about that. Oh, one other interesting part, when I was doing the clinical master's, which became the doctorate, we had to do placements. And because I was doing research on coaching, an opportunity came up through my supervisor to do a placement at the hospital, at the local hospital, in the dietetics department. So I spent, I think, 12 weeks in there working alongside the dietitians who were specifically working with children with obesity. And so I would sit in, and a lot of it was, we had the initial session would be in the clinic with the dietitian. So I'd sit with the dietitian and the parent and the child, and they would then help create, I guess, a dietary plan, a menu plan. And then we trialed some coaching off the back of that initial consultation. So I would, call the child or the adolescent. The adolescents were much more challenging, I have to tell you, but the kids loved it. They loved being able to say, oh, Suzy, I ate my broccoli today, or, I did this, I did that. And so we never published that. Like, we started an article, and I think I just got so consumed with the randomized controlled trial that I was doing that we never finished it. But again, it just made me see the applications of coaching in a health setting.
Yeah, wonderful. Yeah, bringing together the behaviors, the positive emotions that are obviously the foundations of positive psychology, that boost the energy and have those direct mental and physical effects, just bringing all that together. And coaching is about advancing that. It all makes sense. So, yeah.
Absolutely.
Yeah. And so tell us a little bit about how you're using this passion for positive psychology now in your professional life and in your personal life.
Yeah, it really is. And you'd be familiar, Liana, with Carl Rogers' work in humanistic psychology. And he spoke of the way of being. It's a way of being that, in terms, particularly in counseling, but that's translated into the field of coaching now. And when we talk about coaching, we often talk about three key components being, to be a coach, you need skills, and we often call those the micro skills, which are very similar to the micro skills of counseling in many ways, building rapport, for example. Then there's a process, and there are various processes that coaches use. But if you see a visual diagram of these three components, the largest one is the way of being, which is not so much what I do, but it's who I am and how I show up with my clients. And that also aligns to the research on the working alliance, again, accounting for some research saying 70% of outcomes are that bond and the goals and the tasks of the relationship between the client, the coach and the coachee, or the counselor and the client. So I think for me, it has become as much as possible. I'm certainly not perfect, Liana, but it's really infiltrated my whole life. And so even before I came across positive psychology, I was a fan of Oprah, as I'm sure many people have. And I remember sitting at home, it was about 1998. So the year that Marty, formally launched Positive Psych, I was at home with a young baby watching Oprah, and this woman came on to talk about gratitude, and it really changed my life. I went out the next day and bought a gratitude journal, and it was 1997, because I've still got those journals, and it really transformed my life. And so then when I became aware of positive psych in about 2000, 2001, I thought, wow, I've been doing this anyway. Like, this is stuff I'm interested in anyway. And I think, in psychology, all the topics of psychology, but it was a much better alignment for me, because I think, as I said, I realized pretty early on that we were just chasing our tails by treatment, and I was much more in the proactive space. It was just a much better strengths alignment for me as well. So I use it in my whole life. I mean, I start my day with mindfulness or some form of meditative practice. I exercise. So if we're using, say, the PERMA H or the PERMA V model, I've had a really regular health, particularly exercise regime for many, many years now, which I know if I don't, I'm not my best self. So it sort of positively reinforced those behaviors. I practice gratitude. I really try to walk the talk as much as I possibly can, and constantly learning, and I love the research and love to try and apply it as best as I can.
Yeah, terrific. And you just mentioned the PERMA H and the PERMA V model, and we have covered PERMA on other podcasts, but we haven't covered the H and the V. So for our listeners who are not familiar with that, can you describe those?
Yes, and I can't fully reference it, but I think early on, Geelong Grammar, who was the first school in the world to do positive education, they added an H component in there for health. Realising the importance of health to overall psychological well-being. And then I've heard others, and I can't remember the reference, that are using the V for vitality. And then I think even PERMA Plus now, there are versions of it. But I think most of us recognised, and even, again, as a clin psych, one of the first questions, or what we were trained to do was, has the client had a medical review? Have they seen their GP? Because there are a lot of psychological manifestations of physical ill health, and we need to be able to rule that out as well. And of course, it's also one of the most powerful treatments. And I still quote a study, I'm sure it's been superseded, but I remember a big Scandinavian study that showed that people that exercise for 3 times a week for 40 minutes have significantly lower levels of depression that don't. I remember learning that at university years ago, and I still quote that in my coaching work, in terms of it being particularly exercise being a non-negotiable for well-being and performance.
Absolutely. And of course, many of our listeners are health professionals and health coaches and practitioners in lifestyle medicine. So well aware of the importance of these healthy lifestyles. And what we do with the GPHI, or Global Positive Health Institute, is linking all that with positive psychology. And in fact, we're working on this book now, this Lifestyle Medicine from the Inside Out, which is really looking at the science and the practice of putting all this together, which is very exciting, I think, at many levels. It helps us as practitioners of any kind, like say, if we can embrace all of those components, and then we show up differently for our clients and patients, but then also that we can start thinking about, well, how can we really offer this as prescriptions and recommendations for patients, even in more traditional health settings outside of mental health settings and more traditional behavioral health settings. And so this is what we're passionate about. And so keeping that in mind, is there any advice that you have for health practitioners that might be interested in all of this?
Yeah, I think so. I mean, just coming back to my earlier point, and I probably didn't answer your question precisely, but there's a saying in positive education, which I think emerged from the work at Geelong Grammar, which is learn it, live it, teach it, embed it, which basically means particularly if you're an educator and you're going to teach it, you need to learn it yourself. You need to apply it in some form or another to yourself. So you've had a willingness to trial it, because the students are very astute at working out whether this is a genuine expression, or you're just teaching this because you have to. And so, so learning it and living it before teaching it, definitely before teaching it, and then look to embed it. We also have a saying, I guess, in leadership or even in coaching, which is to learn it and live it before leading it or coaching it. So I think, start with yourself. I think that's the first point of call there. But I'd also say to those listening that haven't really thought about coaching as an approach or a methodology, that it is the secret sauce, I call it, of the application of wellbeing science. Because again, you can have all this knowledge, but how are you going to, I guess, share that knowledge or work with a client where they are more likely to take ownership of it, which is you're really trying to enhance intrinsic motivation. So rather than doing it because the doctor told me to, or, whoever the professional was told me to, I start to see why I'm doing it for myself. So that's, if you've never done any training in, for example, self-determination theory, which, as you know, Liana, we call the theory of flourishing, and it is a meta theory. There's a number of subset mini theories underneath it, but one of those is clearly helping people to take that ownership and build up those sense of autonomy, because then they're more likely to apply it. And coaching very much, in essence, that's what it's ideally about. So I was just speaking to a large organisation here in Australia this morning, and their rehabilitation team. Mm-hmm. Now, in my early clinical days, I did quite a lot of workers' compensation treatment, and I can remember just at the time thinking, oh my goodness, this could have been handled so much better, particularly from the organisation or even the rehab counsellors. Like, it was much more, this is what you have to do, telling people what to do, rather than trying to work out what's the motivation for that person. Like, why would they want to get better and get back to work, and building up some hope, hope theory and optimism. And so I'm about to do some education with the rehab team, and they've already done a little bit on motivational interviewing, which they're excited about. But as you and I know, there's a whole lot more there in terms of helping people with behavioural change and, as I said, building up that intrinsic motivation.
Yeah, we often talk about getting to the inner why, and now there's a growing acknowledgement that traditionally, especially in healthcare, we haven't done as good a job of really seeing the patient in front of us and who they are and what makes them click. And so it's wonderful to see this now expanding, and that a lot of people saying that having those aha moments, that this is the crux of where we can really be successful with our clients and patients.
Absolutely. And it's, I mean, having worked, clinically and coaching, when people start to say, oh, right, like I'm doing it, because not just myself, but in the approach that we take in coaching psychology, values form an integral underpinning. So once people get clear on what matters most to them, and then they can align their goals or their intentions with that value, that's what helps shift from potentially extrinsic or introjected motivation, which is that guilt or anxiety, to help move them and them see that, oh, actually this is my goal. It's not my doctor's or my partner's, or it's quite powerful to see that shift happen.
Yeah, it's absolutely very powerful. And this is the heart of what we want to engage a growing community of followers to say, and also positive psychology, in addition to our inner work, that gives meaning to our lives, can also help us engage in activities that boost our positive emotions, and activities like you just mentioned, there's hope therapy. There's many other pathways where we are boosting those emotions, and that opens up our minds so we can problem solve better, rather than seeing those barriers and saying, well, I can't. All of a sudden it's like, well, maybe, let me see, maybe there's a way to work around it. And that's just so amazing to see when those light bulbs go off that way, or go on that way, I should say.
Yeah, and I actually used hope theory as the underpinning theoretical framework for my original doctoral research. That was able to show that coaching is a hope enhancement intervention, because if you think about the three components of hope theory, which is goals, agency, and our sense of self-efficacy or belief that we can achieve it, and then the multiple pathways. So in coaching, we help people articulate not just any goals, but personally meaningful goals, again, alignment to values. In the type of research I've done, it's been primarily cognitive behavioral solution focused. So the cognitive behavioral is working on the agency and the beliefs, the ants, we call them, the automatic negative thoughts. In fact, my colleague, Professor Stephen Palmer in the UK, who published one of the first papers on health coaching. I don't know if you've met Stephen yet, but Stephen calls them the hits and the hats. So the health inhibiting thoughts, and then the health affirming thoughts. And so we use that cognitive behavioral. I mean, that can be quite powerful. And then just through taking a solution-focused coaching approach, you're building up the pathways, the multiple pathways to achieve their goals. So, yeah.
Yeah, love that. Love that. The hits and the hats. I've heard that. That's terrific.
Yeah.
Well, what are some of your favorite resources in positive psychology that you'd like to make sure our listeners know about and may check out for themselves?
Absolutely. I mean, I've mentioned for myself, I'm not an expert mindfulness practitioner, but every day I personally use, I've probably used every app that's out there, Liana. I like to, give them a test run so that I can make recommendations. I like Insight Timer. I like, the variety that's on Insight Timer, the courses. Calm app I quite like. I love the sleep stories. So napping's one of my go-to strategies as well, Liana. And I'm well aware of the research of keeping it from no more than 15 to 20 minutes. So because I'm an early bird, so I like to get up early, and it's when I can think and be creative. But by 3 o'clock, not every day, but if I get a 3 o'clock, I will do a little 15-minute nap. And I've trained myself to wake up without an alarm, which is pretty powerful. And yeah, I think the positive emotions, I mean, I have been possibly, genetically blessed with a fairly robust mood, which I think is one of the reasons why I moved out of clin psych into positive psych. It felt like a better alignment for me. But so in my book, my first book for the public that I published, called The Positivity Prescription, there's a list and a diary card of 20 different evidence-based, mood boosters that we know. So things like gratitude, I mean, even forgiveness, Shinrin Yoku, forest bathing, nature. So as you know, there's so many different types of strategies that we can use. And I also think back to my clinical training in cognitive behavioral therapy, and one of the key activities in CBT is, when people are particularly feeling depressed, is to increase activities of competence. So you want to build up their sense of competence when they're not feeling, good at anything sometimes, or a sense of hopelessness. But there's always been activities of pleasure. So it's always been there, even in clinical psychology. So we spoke about it, but there was never a big focus on it. Whereas I think the research that's come out of PosPsych, a lot of Sonia Lyubomirsky's work and Barb Fredrickson's work, has really helped us build a very strong rationale and business case as to why consciously cultivating positive emotions doesn't just help us feel good, it helps us function better. Yes. So yeah, I love all the research. I love quoting the research on the why of positive emotions. And of course, there's one of those studies of Barb Fredrickson's with surgeons making, I think, more efficient and more accurate diagnoses, complex cases. And my son-in-law is a surgeon, so I've shared that research with him also as to why he needs to be focused on, looking after himself and keeping his mood lifted.
I love that study. I cite that study a lot in my talks. So I'm glad you mentioned that. So you can be a better diagnostician with positive emotions. Absolutely. So absolutely. Well, our time is up, because we do keep these podcasts pretty brief. So we'll wrap up. And do you have any parting words? Any one thought that you'd like to leave our audience with?
Yeah, I think, look, there's so many resources out there. Try and locate as much, I guess, rigor as you can, because there's a lot. It's become like health and nutrition more broadly, hasn't it? And with the aid of social media, everybody's an expert, and there's so much information. It's hard to sort of critique and work out what's best. So do your homework. And I mean, my hope is that this continues to grow, particularly in undergrad. So I think even in my field of psychology, unless you have a lecturer that has a passion, it's not widespread yet in any of the healthcare fields. So I'd love to see it, like education, where it's taught at undergraduate level, clearly in schools, which has been my area, and in workplaces, which are, again, key institutions where we can get education and hopefully inspire people to be more proactive around their health and well-being.
Terrific. Thinking about the next generation and inspiring and making this standard through all levels of healthcare and health and well-being, and the broader role that, all individuals have if we're thinking about self-care as well as healthcare to maintain our well-being. So that's a wonderful way to end our brief podcast, and maybe we'll bring you back again sometime. Thank you so much, Suzy Green, for joining us today. And thank you to our audience for joining us and listening in. Please subscribe to our channel and listen to the other wonderful podcasts, and join us for another one of these in the near future. Take care, be safe, be well. Until next time, take care, everybody. Bye-bye.